Good morning to all. Today's class is Larynx. So today's contents are introduction, functions, location and extent of larynx, then skeleton of larynx, that is cartilage, ligaments and membranes, joints, muscles. Then what are the subdivisions of larynx? What is nerve supply, blood supply, and in the last, what is applied anatomy? Okay. So introduction, larynx. Here, when you are seeing here, this one. This is upper extended part of lower respiratory tract infection. Sorry, this is upper expanded part of lower respiratory tract. Okay, this is also known as voice box or organ of phonation because it produces voice. It acts as sphincter. Okay, so here it is acting as a sphincter at inlet of lower respiratory tract. See here, this is the upper respiratory tract, and here, beginning from here, this place where laryngeal inlet is there, so this is the beginning of lower respiratory tract. So it is acting as a sphincter. Sphincter means valve, so it is controlling. So when you are eating here, this food should not go into the respiratory tract, but it should go to the the laryngopharynx, and from there it will go to the esophagus and stomach. So it should not go to the respiratory tract, that will be controlled by here, the larynx. Okay, so this will close. Okay, it protects trachea and bronchial tree from any material other than air. Okay, so this food should not come here into the larynx, and then from larynx to trachea it should not go. Okay, if there is any laryngeal incompetence, that means incapability of larynx or any muscle paralysis of larynx, that will result in aspiration of food and fluid into trachea. Okay, so if that is not working properly here, the food will come into this larynx, and from larynx it will go to trachea. Okay, that is known as aspiration. Okay, now what is location and extent? It is here, you can see this is located in the anterior midline of upper part of neck. This is midline, anterior part and upper part of neck. So this is the location of larynx. Okay, here, this one, blue color. And it lies, as I told you, it lies in front of laryngopharynx. So behind one, you see here, this one is laryngopharynx. Pharynx has three parts, nasopharynx, oropharynx and laryngopharynx, and in front of laryngopharynx is the larynx. Okay, so if they are asking you vertebral level, so it lies in front of C3 to C6. This they will ask in MCQ. What is the vertebral level of extent of larynx? It is from C3 to C6. At level of C6, larynx will continue. This larynx will continue as trachea. Okay, in children and females, it is at a slightly higher level. Okay. Then what is the skeleton of larynx? So skeleton of larynx consists of cartilage, ligaments and membranes, joints and muscles. Now those cartilages can be unpaired and paired, ligaments and membranes can be extrinsic or intrinsic. Joints, there are total 3 joints. One is cricothyroid joint, cricoarytenoid joint and arytenocorniculate joint. Okay. And then muscles. So muscles can be extrinsic or intrinsic. Extrinsic means which are present outside the larynx and they will be controlling the larynx from outside, and intrinsic, that means they are present within the larynx. Okay, now first thing is cartilage. So what you are seeing, cartilage, there are total 9 cartilage. Out of 9, 3 are unpaired and 3 are paired. So what you are seeing here, E for epiglottis, T for thyroid cartilage and C for cricoid cartilage. So these 3 are unpaired. Then what are the paired one? Here is 1 and 2, that is arytenoid, this is corniculate and this is cuneiform. So 3 paired and 3 unpaired. So 3 into 2, that is 6, plus 3, that is total 9 cartilage. Okay. Then first one is the largest cartilage. What you are able to see here, this is the thyroid cartilage. You see here this half section of thyroid cartilage, you can see this is the epiglottis. So thyroid cartilage is the largest and most prominent. It consists of 2 quadrilateral lamina. Here is one and here is another lamina. and these lamina are meeting here. They are meeting at thyroid angle. You can see here from side view, you can see this is the thyroid angle, and this angle, when you are seeing this angle, is acute in males. Acute means 90 degree or less, and it is more than 90 degrees. Specifically, it is 120 degree in female. That is why this lamina is more prominent in males, and these lamina meet at anterior at superior thyroid notch. And okay, so this is the superior thyroid notch where these two lamina, this is one and this is two lamina, they both are meeting. That is why that is known as Adam's apple, and Adam's apple is prominent in males because the angle is acute. Okay, now thyroid cartilage, what are the attachment? So when you see the thyroid cartilage, this is the posterior surface, and here is the oblique line, and this is the posterior border. So posterior surface from midline to laterally, first thing is there is attachment of vestibular ligament, then there is attachment of vocal ligament, then here is attachment of thyroepiglottic ligament. So the first one is thyroepiglottic ligament, that means that is between epiglottis and thyroid cartilage, then vestibular ligament, then vocal ligament, and lateral to vocal ligament there is vocalis muscle, and then still more lateral there is thyroarytenoid muscle. Okay, so from midline to lateral on the posterior surface there is vocal ligament, then there is vocalis muscle, and then there is thyroarytenoid muscle. Then at the posterior border, three muscles, they are forming a single tendon and they are attaching here. So what are those three muscles? One is palatopharyngeus, that is coming from the soft palate. Another is salpingopharyngeus, that is coming from the eustachian tube. Okay, that is for, and the third one is stylopharyngeus, which is coming from the styloid process. So they are all attaching at the posterior border of the thyroid cartilage. And here is an oblique line, what you are able to see. Can you see here? This is the oblique line. So this oblique line give attachment to one muscle which is arising from hyoid bone. So that is known as, that is going into the hyoid bone. So that is known as thyrohyoid muscle. Second one is arising from the sternum going into the thyroid cartilage, that is known as sternothyroid. And third one is inferior constrictor, and inferior constrictor only thyropharyngeus part. Okay, inferior constrictor has two part. One is thyropharyngeus part and another one is cricopharyngeus part. Cricopharyngeus part will go and attach to the cricoid cartilage. Thyropharyngeus part of inferior constrictor will go and attach at the posterior border of thyroid cartilage. Then second cartilage is here, this ring shaped cartilage, that is known as cricoid cartilage, and it is situated at the level of C6. Okay, so it is having a lamina which articulate with the inferior horn of thyroid cartilage. Okay, so it will be articulating with inferior horn of thyroid cartilage, and it will be forming a joint that is known as cricothyroid joint. Okay, so it will be forming a joint that is known as, so here this is the site of the, you can see here, this is the lamina of cricoid cartilage and this is the inferior horn of thyroid cartilage. So this is the joint that is known as cricothyroid joint. Okay, third cartilage, the unpaired cartilage, is this one, leaf shaped cartilage, that is known as epiglottis. So you can see here also, this here is epiglottis. So it is leaf like, it extends behind hyoid bone. So this is the hyoid bone and the base of the tongue. This is the base of the tongue. So this is the hyoid bone. It is upper end is this one. Either you can say this one or you can say this one. So here it is broad and free and it forms the upper boundary of laryngeal inlet. So here you see this is the laryngeal inlet. So it will go in this direction. Okay, it will fall down. Okay, so that is, it will close. Lower end is pointed. This is the lower end. It is pointed. It is connected to the posterior surface of the angle of thyroid cartilage by thyroepiglottic ligament. I have shown you here. This is the attachment of the thyroepiglottic ligament. Then what is the anterior surface? So here this is the anterior surface, or you can say this is the anterior surface. So this anterior surface is connected here to the base of the tongue by threefold. One is median, glossoepiglottic fold, and 2 on either side there will be lateral glossoepiglottic fold. So here you can see that will be attached to the base of the tongue. Depression on each side. So here when you see on either side of this median glossoepiglottic fold, there will be a gap or a space that is known as valliculum. And now here this is the posterior surface, or you can say here behind, this is the posterior surface. Here there will be a tubercle on its lower part. Okay. Now arytenoid cartilage, you can see here, this is arytenoid cartilage, this is arytenoid cartilage. It is articulate with the cricoid lamina. Okay. So what does it have? It has a muscular process, it has a vocal process, it has a base, and it has apex. What is muscular process? So this one here, this is a muscular process, this is vocal process, here is the apex, and this triangular shape, that is the base. Okay, so you are able to see now. You will not be able to make in 2D, but 3D when you see, this will be a triangular, that is the base, this is the apex, this is the vocal process, this is the muscular process. So first, muscular process, it is projecting laterally and backward. Vocal process, it is directed forwards. And base, here is the base, which is concave, which is articulating with here the lamina of cricoid cartilage. So base is here, it is anteriorly, it is forming the vocal process, and laterally it is forming muscular process. Apex is here, that is curved one, and it is articulating with corniculate cartilage. Okay. Now here two cartilages, small cartilage are there. This one is corniculate cartilage and this one is cuneiform cartilage. Corniculate cartilage is known as cartilage of Santorini. It articulated with piece of arytenoid cartilage. That means it is articulating here. This is corniculate, this is arytenoid cartilage. So corniculate is articulating with arytenoid cartilage. Second one is cuneiform cartilage of Risberg, which is articulating. This is the cuneiform cartilage, small, very small cartilage. It is lying in the aryepiglottic fold. Aryepiglottic fold means from arytenoid cartilage to here, epiglottis, that is aryepiglottic fold. So that cartilage which is present in the aryepiglottic fold is known as cuneiform cartilage. So these are two pair of small cartilage. One is corniculate, this is cuneiform, this is larger one, a pyramidal shape, that is arytenoid cartilage. This is single cartilage, cricoid, this is thyroid cartilage, single cartilage, this is epiglottis, single cartilage. So total 9 cartilage. Okay, then what are their types? So remember, thyroid cartilage, cricoid cartilage, and base of the arytenoid cartilage. Thyroid, cricoid, and base of the arytenoid cartilage, they all are hairline type of cartilage. They tends to ossify after 25 years of age, and they can be seen in radiographs. What about the apex of arytenoid cartilage, epiglottis, corniculate, and cuneiform? So they all are elastic cartilage. They does not ossify. So you see here epiglottis, corniculate, cuneiform. Then here apex of the arytenoid cartilage, that or vocal process of arytenoid cartilage, they all are elastic cartilage, but thyroid cartilage, cricoid cartilage, and the base of the arytenoid cartilage, they all are hairline cartilage. Okay, so that is what is the different type of cartilage. Then ligament and membrane, extrinsic ligament and membrane, example is thyrohyoid membrane. So you are able to see this thick membrane. So that is attached to the hyoid bone and the upper border of the thyroid cartilage. So this is known as thyrohyoid membrane. And the posterior part here you can see in the median part and the lateral part, that is thickening. So thickening of this membrane is known as ligament. Okay, this membrane is known as thyrohyoid membrane, and if it is thickening here, lateral aspect, median aspect, that is known as ligament. So what is subhyoid bursa? It is present here between the posterior aspect of hyoid bone and the membrane. So in between them there will be a bursa, that is known as subhyoid bursa. And what are those median and lateral thyrohyoid ligament? As I told you, these are the thickening of thyrohyoid membrane. Thyrohyoid membrane, remember they will ask you in MCQ, it is pierced by two structure. One is internal laryngeal nerve and another is superior laryngeal vessel. Okay, then another membrane is cricotracheal membrane or ligament. So here it is present between the cricoid cartilage and first tracheal ring. Then another ligament is present between the thyroid cartilage and epiglottis. Okay, so that is known as thyroepiglottic ligament. Another ligament is hyoepiglottic ligament, that is present between the hyoid bone and epiglottis. You can see this is epiglottis and this is hyoid bone. So that ligament is hyoepiglottic ligament. Third one is cricothyroid ligament. So this is thyroid cartilage, this is cricoid cartilage. So this ligament is known as cricothyroid ligament. Now, what are the intrinsic membrane? So here you are able to see this is one membrane and here is one membrane. Okay, so a membrane which is arising from the cricoid cartilage and going into and attaching into the vocal fold here, that is known as cricovocal membrane. So it is arising from the upper border of arch of cricoid cartilage, upper edge here. It is attached to the anteriorly to the posterior surface of thyroid cartilage, as I have shown you previously, and posteriorly it is attached here to the vocal process. You can see here anterior, this is the cricovocal membrane. You can see this one. This is the triangular membrane, cricovocal membrane attached here anteriorly on the posterior surface of the this one thyroid cartilage and posteriorly to the vocal process of this one arytenoid cartilage. It is thickened. Okay, so this will be thickened here, that is known as vocal ligament. So cricovocal membrane is this whole thing, and if it is thickening here, that is known as vocal ligament. Okay, so lower edge is here, lower edge is thickened here, and that will be known as vestibular ligament. Okay, vestibular ligament. Now what is the vestibular ligament? You can see here, sorry, just a second, I missed that thing. Okay, so what you are seeing here, this is the, I told you, the cricovocal membrane, this is vocal fold. Okay, so this vocal ligament is actually thickening of the cricovocal membrane. Vocal ligament is thickening of cricovocal membrane, and this ligament is covered by a fold of mucous membrane, that is known as vocal fold. So three things understand: one is membrane, one is ligament, and one is fold. So fold means vocal fold, and it is fold of mucous membrane. Ligament means thickening of the cricovocal membrane. Okay, so what is vocal ligament? It is made up of yellow elastic tissue. It extends from posterior surface of thyroid cartilage to vocal process of arytenoid cartilage. Okay, so it is here from thyroid cartilage to vocal process of arytenoid cartilage. Okay, then second membrane, what you are seeing here, this quadrangular membrane, or you can see here, it is arising from the sides of epiglottis to arytenoids. Okay, its lower edge is free. Here you can see the lower edge is free, and it is attached anteriorly here to the posterior surface of thyroid cartilage and posteriorly to the lateral surface of arytenoid cartilage. Okay, and lower edge here it is thickening to form the vestibular ligament. See, cricovocal membrane is thickening in upper part and it is forming the vocal ligament, and quadrangular membrane is thickening in the lower part to form vestibular ligament. So vestibular ligament is formed of fibrous tissue. It extends from the posterior surface of thyroid cartilage to the lateral surface of arytenoid cartilage. Okay, so that is what I have told you. One is cricovocal membrane, second one is vocal ligament, third one is vocal fold. Here you see the quadrangular membrane and vestibular ligament. Now what are the true vocal cords? True vocal cords are nothing but the vocal folds. Vocal folds means the mucous membrane which is covering the vocal ligament. Okay, the vocal fold is nothing but the mucous membrane which is covering the vocal ligament. What is vocal ligament? Vocal ligament is I have shown you, Vocal ligament is nothing but the thickening of the here cricovocal membrane is known as vocal ligament. Okay, so vocal folds are the true vocal cords. Okay, each vocal fold includes a vocal ligament and a vocalist muscle. Okay, so vocal ligament is elastic tissue that is thickened medial free edge of lateral cricoarachnoid ligament. Okay, vocalist muscles are the fibers that form most medial part of thyroarachnoid muscle. So here you are seeing that is true vocal cords or vocal folds. Then false vocal cords. False vocal cords means the vestibular fold. False vocal cords means the vestibular fold that extend between the thyroid cartilage and arytenoid, and it have no role in voice production. It just serve as protective function, and it is the mucous membrane covering lower border of quadricular membrane. Then what is vocal cords abduction and adduction? You are able to see this is the vocal cord here and here. When they are going away from each other, that is abduction. When they are coming closer to each other, okay, that is adduction. So here you can see these are the vocal cords abducted and here the vocal cords adducted. So during breathing what will happen? The vocal cord will make space so that air will go inside, and that is known as abduction. During any kind of straining effort or before cough or before sneeze, because the pressure should be increased, so in that case they will be adducted. Understood the difference? What is the abduction of the vocal cord and what is the adduction of the vocal cord? Okay, now what is voice production? Voice production is, it is because of result of escape of small amount of air between the adducted vocal cord. So here if these vocal cords are adducted, small amount of air will pass through it, and that will be known as, and that will be producing the voice. Okay, so do you you got it? What is abduction? What is adduction of vocal cord? Then what are the muscles? So muscles are, there can be intrinsic muscle, they move larynx as a whole. That means they are taking origin from somewhere else, they are coming and going, inserting into the larynx. So they will be either depressing the larynx or elevating the larynx. Okay, all extrinsic muscles are paired. Okay, because they will be active on both sides. What it can be? It can be palatopharyngeus. Okay, it can be palatopharyngeus means from palate to pharynx. Okay, so palatopharyngeus means here, this is the muscle, that is palatopharyngeus. Second is salpingopharyngeus. So here coming one from around the eustachian tube, that is salpingopharyngeus. Third one is stylopharyngeus, that is coming from the styloid process, that is stylopharyngeus. Third one is, I told you, then thyrohyoid, that is from the hyoid bone to the here hyoid bone to thyroid cartilage, that is thyrohyoid. And fifth one is sternothyroid, that is coming from below. Okay, so that will be coming from the here, this is the sternothyroid coming from the sternum and inserting into the thyroid cartilage, that is sternothyroid. You can see here. Okay, so infrahyoid strap muscle. Infrahyoid means sternothyroid or thyrohyoid. What is sternohyoid? Means from sternum to hyoid bone. What is sternothyroid? From sternum to thyroid cartilage. What is thyrohyoid? That is from thyroid cartilage to hyoid bones. All these are depressor of larynx. What about the palatopharyngeus and stylopharyngeus? They are elevator. Palatopharyngeus here, coming from the soft palate to larynx. So stylopharyngeus from styloid process to the larynx. So they are elevator of larynx. What about the intrinsic muscle? They move part of larynx. That means they will move the vocal cords. Okay, or they will move the epiglottis. So they control length and tension of movement of vocal cord. They may help in closure of laryngeal inlet. So here you see the muscles which either open or close laryngeal inlet. So this is the laryngeal inlet. So here is the muscle that is known as oblique arytenoid. Okay, oblique arytenoid, and that will be continuing as epiglotticus. That means from arytenoid cartilage to epiglottis. Okay, so that is known as epiglotticus. So that will close the inlet of larynx. Another muscle is here, which is attached the epiglottis to thyroid cartilage, that is known as thyroepiglotticus, and it will open the inlet of larynx. So here these two muscles will approximate, so they will close the inlet of larynx. Approximate, they are coming to each other. Okay, and this will pull it down. It is coming from thyroid cartilage to epiglotticus. It will pull it down, so it will open the inlet of larynx. Then what about abduction and adduction of vocal cord? So abduction and adduction of vocal cord, they are, one muscle is here, posterior cricoarytenoid. So posterior cricoarytenoid means this one here. You can see from cricoid cartilage to arytenoid. So it will pull like this. It will pull like this and it will like this. So it will abduct. That means the vocal cords are going away from each other. Then lateral cricoarytenoid, that means from cricoid cartilage to arytenoid cartilage. So cricoid cartilage, okay, to arytenoid cartilage, that means coming like this. Okay, so that is known as adductor. And another one is here, the transverse arytenoid, this one like this transverse direction, that is also adductor. Then what about the muscles which increase or decrease tension of vocal cords? So one muscle is here, cricothyroid, that is tensor. Then here is vocalis muscle, that is tensor, and thyroarytenoid, that means from thyroid cartilage to arytenoid, that is a relaxer of vocal cord. Okay. Then what about the joint? There are three joints. One is cricothyroid joint between cricoid cartilage and thyroid cartilage. Second one is cricoarytenoid joint between the cricoid cartilage and arytenoid cartilage. Third one is arytenocorniculate joint, that is from arytenoid cartilage and corniculate cartilage. So cricothyroid joint is most important joint. It is plain synovial joint between inferior cornu of thyroid cartilage and side of cricoid cartilage. It permits two type of movement. One is rotatory movement, another is gliding movement. Second joint is this one between the cricoid cartilage and arytenoid cartilage. This is also plain synovial joint between base of arytenoid and lamina of cricoid cartilage. It also permit a rotatory and gliding movement. Third one is between arytenoid and corniculate cartilage. It is also synovial joint, but there is no functional significance. Then what are the subdivision of laryngeal cavity? So here you see this is the laryngeal cavity section. So when you see, it can be divided into three parts. One is this here. This is vestibule or supraglottic compartment. This is glottis compartment, and here this one is subglottis compartment. So vestibule or supraglottis compartment, that means one which is bounded by the quadrangular membrane. Okay, so it is from laryngeal inlet to the vestibular fold. Here is the vestibular fold. Okay, it includes epiglottis, aryepiglottic glottic folds, false vocal folds, arytenoid, and ventricle. So this one is supraglottic compartment or vestibule. Then this one here, this is glottic compartment. It is between vestibular and vocal fold. And third one is subglottis. So here, this is below true vocal folds to inferior border of cricoid cartilage. So this one should be the subglottis compartment. Then what is rima vestibuli? So here you see this is space between the vestibular fold. This is space here between the vestibular fold is rima vestibuli. The space between the right and left vocal fold, this one is rima glottidis. I will show again. Here, can you see this space between the two vestibular fold or false vocal fold, that is rima vestibuli, and the space between the two vocal fold or true vocal cords, it is rima glottidis. Okay. Then ventricle. So here you see lateral depression. Okay, this depression and this depression between true vocal fold and true vocal cord and false vocal fold, that is known as ventricle. It is lined by mucous membrane. And what is saccule of larynx? Narrow blind diverticulum. Okay, so it is narrow blind diverticulum. Okay, it is extend posterior superiorly like this here. That is between the vestibular fold and lamina of thyroid cartilage. So here this will be the saccule of larynx. Then what is nerve supply? So here is the nerve supply. First thing, sensory. So above the vocal fold, here are the vocal fold. Above the vocal fold means the supraglottic and glottic compartment. The sensory is by internal laryngeal branch of superior laryngeal nerve. Okay. So here is internal laryngeal. I told you that thyroid membrane is pierced by one nerve and vessel. Nerve is internal laryngeal nerve and vessels are superior laryngeal vessels. Okay, nerve is internal laryngeal nerve. So here you see above the vocal cords, that is supraglottic and glottic compartment, internal laryngeal branch of superior laryngeal nerve, and here below it will be by recurrent laryngeal nerve, that is subglottic compartment. What about the motor? So all the intrinsic muscles are supplied by recurrent laryngeal nerve except cricothyroid. Cricothyroid muscle is here, which is getting the nerve supply from external laryngeal nerve, and cricothyroid muscle is tensor of vocal fold. Okay, then what is the blood supply? So blood supply arteries, here you can see superior. Okay, superior and inferior laryngeal arteries are branches from superior and inferior thyroid arteries. Okay, this is inferior thyroid artery, this is superior thyroid artery. Superior thyroid artery will give superior laryngeal artery, inferior thyroid artery will give inferior laryngeal artery, and they will accompany internal laryngeal and recurrent laryngeal nerve. That means superior laryngeal artery will accompany the internal laryngeal nerve, inferior laryngeal artery will accompany the recurrent laryngeal nerve. Venous drainage is to the corresponding veins. Okay, then what is the applied anatomy? First you have to differentiate how the child larynx is different from the adult larynx. So child larynx is more anteriorly placed larynx. So here will be short trachea and short neck, and it is proportionally larger head and tongue. Narrowest point in pediatric airway is cricoid cartilage, but in adult the narrowest point is vocal cords. Okay. Second thing, laryngeal carcinoma. Laryngeal carcinoma is most common head and neck cancer. The predisposing factors are smoking and alcohol. Most common type is squamous cell carcinoma in 95% cases. What can be the presenting symptom? There can be hoarseness, dysphagia, dinophagia, sore throat, rhaphidotelalgia, wet nose, and neck mass. Laryngeal tumors arise most common is in the glottic compartment, then supraglottic, and least common in subglottic compartment. Okay. Then what is epiglottitis? Acute inflammation of epiglottis and supraglottic structure. Okay, that is known as epiglottitis. Haemophilus influenza is the most common organism which causes epiglottitis. What are the clinical trial of 3Ds? That is drooling, dysphagia, and respiratory distress. Okay. What is tracheostomy? Tracheostomy is opening made into anterior wall of trachea to establish an airway. What are the indication? It is done. See, we are making an opening in anterior wall of trachea to establish an airway. So what are the indication? It can be upper airway obstruction or inability of patient to manage secretion, or prolonged intubation or facilitation of ventilation support, or inability to intubate, or adjunct to major head and neck surgery, or adjunct to management of major head and neck trauma. In all these cases, tracheostomy will be done. Okay. Second thing is, what is cricothyroidotomy? So it is emergency incision through skin and cricothyroid membrane to secure a patient's airway during certain emergency. It is easier and faster than tracheostomy. It is used when oral and nasal intubation is not possible. So if somebody asks you what is the difference between cricothyroidotomy and tracheostomy, so cricothyroidotomy is temporary airway. It is done where it is done in the cricothyroid membrane. Tracheostomy, it is a definite airway and it is done in the trachea. Then what are the different kind of dysphonia? Dysphonia means the disturbed voice production. So adductor spasmodic dysphonia. So here what happens? There will be sudden involuntary muscle spasm which will cause the vocal cord to slam together. That means adduction is happening and they will become stiffened. So speech may be choppy and sound will be similar to stuttering. Okay. Remember, adductor spasmodic. Okay. So because of muscle spasm, adduction has happened. So that is why dysphonia will be there. Okay, this is not adductor, this is abductor. So here what happens? It is abductor. Okay, sudden involuntary muscle spasm. So here the muscle, the vocal fold will open. Remember, this is not adductor, this is abductor. So vocal fold cannot vibrate. When they are open, they will not be able to vibrate. So that what will happen? That air will escape from lungs during a speech production. So that is why voice will be very weak, quiet, and breathy or whispery. Okay. So that is abductor spasmodic dysphonia. Third one is spasmodic dysphonia. That means here adductor and abductor both component will be there, and spasms are often absent during activities such as laughing or singing. So during laughing and singing there will not be spasm, but when normal speech production is needed, then there will be spasm. So it becomes worse because of stress. Okay, what is the treatment? Most effective treatment of spasmodic dysphonia is injection of very small amount of botulinum toxin, okay, directly into the muscles of larynx. Okay, so these are three different type of dysphonia. Okay, so thank you. That is today's class. Thank you.